go ahead and close your privacy barrier just so we have a little bit of privacy. How are you feeling today?
I'm okay.
All right, and can I get your name, please?
John Smith.
John Smith, all right, and can I also get your date of birth?
11/15/84.
Awesome, I'm just checking the wristband to make sure you're you. Alrighty then, and how are we feeling today? I'm gonna go ahead and raise you, is that okay?
Yeah, you can raise it.
All right. Okay. And how are you feeling today? How did you sleep?
It wasn't great.
Wasn't great? Why's that?
These hospital beds they're just not comfy.
Yeah, it's understandable. Maybe I can grab you some more pillows or blankets. Is it okay if I sit you up?
Yeah.
All right. So we're gonna get him to a nice, comfortable height for myself, as well as we're sitting him up so I have more access to him. I'm gonna go ahead and put the bed rail down just so I have more access. All right, Mr. Smith, is it all right if I start your head to toe assessment?
Of course.
All right, I'm gonna go ahead and feel your head. Right now I'm feeling for any abnormalities around the skull. All right, I'm also gonna look at the hair texture as well as make sure that everything is looking okay. And what I'm gonna do is I'm gonna go ahead and feel your sinuses. Please let me know if you're feeling any pain or discomfort. Awesome, and now I'm gonna feel the back of the ears. I'm gonna go ahead and feel those lymph nodes and look for any swelling. Feeling down the throat, I'm gonna go ahead and find your pulse. Beautiful. Can you go ahead and swallow for me? Thank you. And then can you bite down? I'm gonna make sure I'm feeling the jaw. Awesome. Alrighty then. So this is my pen light. It shines a little bit of a light. I'm just gonna take a look at your eyes, your ears, and your mouth and your nose. All right, can you go ahead and follow it for me and just do an H? Awesome. Go ahead and move just your eyes and not your head. Amazing. Amazing. And then now what we're gonna do is there's gonna be a little bit of a light. I'm looking to see both pupils to make sure they're reacting. Awesome. And we're gonna do this eye. Awesome. And then what I'm gonna do is I'm gonna go ahead and check your ears. Can you go ahead and turn your head for me so I can check the other ear? Awesome. Can you go ahead and open your mouth? Say ah. Thank you. I'm gonna check the nose. Alrighty. And can you go ahead and puff up your cheeks for me? Thank you. Can you go ahead and smile? Thank you. Alrighty then.
Okay, so we're gonna do a neurological test and we're gonna touch our finger to our nose and he's gonna do it on either side. He performs it well. Neurologic is done. We're gonna move to respiratory and circulatory system. So we're gonna check the carotid pulse on either side. Looks good. Sensing and asking the patient to move left and right to see the thyroid gland. Looks good. And then we're gonna remove and ask the patient if we can start the breathing sounds. Do full inhalation and expiration on every breath when I set it down. 2, sounds good. It's even on either side. Okay, and now I'm gonna check for the apical pulse, running for a full minute. Looks good. And now I'm gonna ask patient to move forward and we're gonna do breathing sounds in the back. Looks good and even, no crackling. Go ahead and sit back for me, great. So checking the brachial pulse to make sure it's even. And then watching the chest rise and fall with the radial pulse. We're gonna check if it's even on either side as well. Looks good. And then we're gonna do a range of motion test on either side. Can we move forward and back? Great. Can we do side to side? Excellent. And can we move and wiggle our fingers? Great. And then doing a strength test, can we grip really hard? Yes. And then doing testing capillary refill under 2 seconds. Looks great.
Okay, Mr. Smith, I'm just gonna check your abdomen, okay? So I'm gonna ask you to bend your knees just so that your stomach is more relaxed. And then I'm gonna expose only your abdomen, covering the rest. So I'm gonna look first and inspect. No distension, no redness, no stomas. And then I'm gonna auscultate. I'm gonna start here first, and I hear a sound, so I'm gonna move on. Hear a sound here, then I hear something here, and something here. Good, your stomach is active. So I'm just gonna put my hand here and see if I can hear something.
Your stomach sounds good. Now I'm just gonna push down a little bit. Let me know if you have any pain, okay? I'm gonna use one hand and palpate lightly. And I'm gonna use two hands, go a little bit harder. Are you having any pain?
No pain.
Okay, and then I'll cover you back up. When was your last bowel movement?
Yesterday.
Yesterday? What's your bowel movement pattern usually like?
Usually every day.
Usually every day? Okay. Hopefully we have one today. Are you having any trouble tolerating your food?
It's not great, but it's fine.
Okay. Any nausea, vomiting?
Nothing.
Okay. And then I'll check your bladder while we're here. Are you feeling any pain there?
No.
No. Are you having any pain when you pee?
No.
Any blood?
No.
Okay. If you had any urine, I would look for color, clarity, volume, if there's any pus, and that's the abdomen.
Alright, mister, we're gonna raise you up just a little bit. Okay, we're gonna stop you right there. I'm gonna lower your knees a little bit though, so I can get everything nice and straight. Perfect. Alright, let's take a look at those legs. Wow, are you a runner? Look at that. I'm gonna pretend these are off. Alright. Let's see. The sides are huge. So muscular. Alright, everything's looking good. The posterior tibialis is pulse is looking good. You're feeling good. Dorsalis is also feeling good, nice and steady, even on both sides. All right, I'm gonna check for capillary refill. Everything under 2 seconds. All right, can you extend your feet for me? I'm sorry, flex them. Nice. Can you extend them? Okay. I'm gonna press down. Just press up a little bit. Okay, solid. Oh my God, how do you do that? Bend your knees a little bit. Let me know if anything hurts. Okay. Can we put them out a little bit? Put your legs out. Nice hip flexion. That's amazing. You gotta show me your secrets. Let's see. Bony prominences, everything looking good. No skin integrity or impaired skin integrity. All right. I'm gonna look at your backside. Do you mind grabbing onto that rail for me?
Sure.
Perfect. All right. I know that hurts. I'm sorry. Everything's looking good. Looking good. Okay, no redness. All right. I'm gonna lay you back down. All right, there we go. You comfortable in that position?
Yes.
Perfect. All right, I'm just gonna lower the bed, get you nice and low. And put up one of the guardrails. All right, here's your call light.
Over
Here are
there.
your glasses. You ready to eat? Yeah, I'm ready to eat. All right, here you go. You said you want to eat like that? No, we gotta raise you up a little bit. All right, perfect. Well, enjoy your breakfast. Thank you. See you in a bit.